Patient education for patients with vertigo. Vertigo is a specific type of dizziness that is characterized by the sudden sensation of feeling off balance or that the world around you is spinning. Along with dizziness, people may also experience nausea or vomiting, headaches, double vision, or racing heartbeat. The feeling can come and go, or it can last for hours or days. Types of vertigo. There are two possible causes of vertigo: the peripheral and central vertigo. The central vertigo refers to the dizziness or vertigo that results from a problem in the brain. The area of the brain that is usually affected is the brainstem or cerebellum. Peripheral vertigo. Peripheral vertigo refers to the disorders that involves disturbances in the inner ear. The common disorders that may affect the inner ear, thereby causing the person to experience dizziness or vertigo, include vestibular neuritis, inflammation of the vestibular nerve, which is responsible for taking the nerve impulses from the semicircular canals in the inner to the brain. Labyrinthitis, inflammation of the labyrinth, which is also in the inner ear, and most of the time may also involve the vestibular nerve. Both of these disorders are usually caused by a viral infection that may have reached the inner ear. The Meniere's disease. This occurs due to increased fluid in the inner ear. And the most common cause is the benign paroxysmal positional vertigo, or the BPPV. This results from the movement of the otolith, which is very small particles made of calcium inside the ear. The otolith organs detect the movement of your head and its relation to gravity. For some reason, the otolith can be dislodged and move into the semicircular canals and affect the movement of the fluid inside, causing it to send irregular nerve impulses to the brain, making the person get dizzy. Here are some exercises to help you reduce the severity of your vertigo. The Brandt-Daroff exercise. Start in an upright seated position. Then lay down on your side, turn your head up at about 45-degree angle. Stay in this position for about 30 seconds. Now move back to the seated position and stay for 30 seconds and repeat on the other side. Do this for 5 times twice a day for at least 2 weeks. Gaze stabilization exercises. Keep your head in one spot, move your eyes side to side for 10 times. Then move them up and down for 10 times. Next, move them at a diagonal 10 times one way, and then 10 times the other way. Now you're going to move your head but keep your eyes focused on one spot. Hold your finger in front of you while focusing on the one spot. Move your head side to side as smoothly as you can 10 times. Then move it up and down 10 times. Next, move it at a diagonal 10 times one way and then 10 times the other way.